I get myself in trouble all the time, but I feel like I'm just saying what's in my heart. And, I'm in this industry because I love people and I love animals and I want to see everyone have a choice. It's not fair to not have choices. We're not looking to kill anybody. Nope. We have opportunities to discuss drug interactions with everybody. But it has to come from the pillars of the community, and I consider us pillars. We're pillars of the cannabis community in a nascent, we're only 10 years young, so we've got time to shape it up.
Hi, everyone, and welcome back to Harmonia Podcast. I am joined here today by Heidi Whitman, who is this absolutely incredible human being. Uh, and is going to talk to us about medical cannabis and her experience with patients, as well as her own personal experience and experience with medical cannabis around pets, which is actually quite interesting. So, without further ado, I am going to hand over to Heidi to, I suppose, formally introduce herself. Hi, Heidi.
Thank you so much. Thank you. Hi, Berta. This is really exciting. I'm so happy to be here today. My name is Heidi Whitman. I'm an American expat living here in the UK. Been here for going on 11 years. And cannabis has been part of my life since I can remember, being my father was self-medicating his whole life. I'm very familiar with the plant. I grew up around the plant. I grew up people dealing the plant. Then I soon, as I evolved, I grew up understanding what the plant's properties were and why people were self-medicating. Um, as fast forwarding from all those years till today, I have been working in the industry since 2017. I started off with a cannabis or a CBD brand, sorry, for people and for pets. My background has some veterinary medicine technician work, and I thought this is something if it benefits the ECS, it's going to benefit the ECS and everybody. So I started a company called the Naked Leaf and later sold it, and then became a strategist for different companies. And some of those were medical. And the medical cannabis companies really opened up my eyes to the entire supply chain, the loopholes, the issues, the problems, the work that we need to do collectively in order to streamline things to get patients the access that they need in an affordable manner. So the simplicity has been something that has been my core focus on how we can make the system for everybody, including pets, which is another subject, but we can divert into that. So, as of today, I'm a global cannabis strategist for a group called Swiss Queen out of Zurich, and I consult for them full time. I am active on many different extracurricular positions. I am a co founder of the Empower Her Cannabis Society for women, supporting women on this journey as well on a global scale. So we have 22 countries and 510 members. And I also support as an advisor for the Global Cannabis Network Collective on their board. And I'm on the board of directors for a group called Pet Pharmaceuticals UK, which is where the cannabis for pets comes into play.
Wow, Heidi, this is why I said amazing, Heidi. No, honestly, the work that you've done is absolutely incredible. And I really cannot wait to hear about the pets. But before we go into that, I suppose let's talk about medical cannabis and I suppose your own personal journey with it. And what sort of inspired you to, because I know you do a lot of advocacy for medical cannabis as well. I know you do a lot of women's work around medical cannabis as well. What sort of inspired you to go down this journey? I'm assuming it's definitely going to be related to your own personal experience.
Yes, absolutely. Well, it's interesting because I feel like we all are in this space because there's something that has touched our heart that's driving us. There's no getting out. Once you're in, you're in. And I think you're in because this is the future. And this is what we have to do is introduce right back where we started from many years ago, cannabis-based products for health, whether it's for food, whether it's for shelter, for hemp, whether it's for medical cannabis grown as a pharmaceutical. There is no need for us to be pumping as many drugs as we have been pumped into our bodies by the typical pharmaceutical systems. I'm not against pharma, but I do believe there are complements and alternatives that should be offered, and patients should have choices. So, I just to revert to my past, my father had a glioblastoma brain tumor in 99. He was given 11 months to live, and he died literally 11 months to the day. But this was a man that used cannabis on a daily basis because of his own depression and his own anxiety and then gets thrown into a veterans hospital in Florida where none of that is available. So I saw my father decline rapidly. Now I knew he had a death sentence, I knew he had a nasty tumor, but in 2000, me trying to bring cannabis joints in for my father was not going over very well in Florida. So I was lifted and removed several times, or I would hide them in my baseball hat and walk. It just didn't work. And I just wanted my father to have relief because even if he was dying, why should he be so anxious and depressed? Why should he be removed from the medicine that he had medicated himself with for so long? It was probably really crummy, not so great cannabis, but it did its trick. Sadly, my father passed, and now in 2022, I think 23, New Zealand did do a study in regards to the quality of life for people with glioblastomas, like my father, using cannabis throughout their journey of their treatment and their quality of life. So I was ahead of my time thinking this would be a solution. I had no idea of the pharmacokinetics of the process, but it did seem to obviously help my dad in any way. Fast forward to myself, I was always a very healthy person. I used cannabis recreationally when I could. I ran a couple companies, so for me, it was like being on point all the time was really important. But I do have ADHD. I do have insomnia from that, and I'm also in early menopause from a hysterectomy. So my own personal journey, my hysterectomy came about 8 years too late. So I lived for almost a decade with severe and chronic pain. And I think that's why the female side of this entire concept of bringing a different alternative to people in the who are getting pharmaceutical support from their regular GPs needs to be tuned up. And we might have an opportunity as a cannabis industry to start highlighting the lack of care females get with their diagnostics. And I never knew this was all coming together. This was just my own personal thing going on where I was in pain. I was founding companies. I was working full time. I was raising two stepchildren and my dogs and my horses and taking care of my mom. And everything was happening at the same time. And I was in pain. I think I survived that almost decade and advocating for myself nonstop, trying to get help through our NHS here, which I have ended up doing during COVID because I think I screamed loud enough, someone heard me, but I shouldn't have to do that. And I was also told upon my surgery that how did I live like that? And the reason why how I lived like that with the pain on my spine and tumors all over me was because I was using cannabis all the time. And if I didn't use cannabis all the time as a non-patient through the legacy market, I don't think I would have been able to be a functioning step parent, to be able to run a company, to be able to be available for my family and sleep. So those were things that I really needed. Sleep is really detrimental to the brain, to everything. We know how it's important. I mean, not detrimental, lack of, and so fast forward, I'm now in menopause, woohoo, and I have an aging parent. So I didn't get out of the loop of, of craziness, but I ended up getting some more things that I needed to handle. And where did I go back to? The plant. This time I'm a medical patient. And I got my medical prescription here in the UK. Super easy to do, super easy to access. It lasts a long time. I think so my point is, the way that the system works is easy if the people are educated. So my goal as a professional in the industry, of course, I have my regular job, but I also think it's really important to educate the community that are canna curious or canna naive. And if we can bring them into understanding that they can have a solution, so they don't need to suffer those decades, they don't need to have an aging parent and the complications of menopause to weigh them down as female household leaders. This is something that I feel very passionate about, and that's why we started doing some outreach programs with the Empower Her Cannabis Society, getting people like Berta to speak to people that don't have any clue of what's going on with the cannabis world. They don't even know that it's legal. They're still wondering if CBD is. But why not educate from a grassroots effort? It's exhausting, it's time consuming, but it's necessary. So myself, I take it every day. I have a mother with Alzheimer's disease. She's on it every day too, and it's very, very, very helpful.
And just to talk a little bit about your mom with Alzheimer's, because this is something that we're seeing more and more of now within the industry, is more people coming in with Alzheimer's and dementia. How does medical cannabis support them?
Well, at the moment, to be honest, my mother's on a legacy market product, which is with oils, because I had to make something for her that she could take. You're not going to have an 80-year-old with Alzheimer's put a vape to her mouth. It's just not going to happen. And I think that's where we're lacking in product delivery systems here. So I think if we could start looking at the US and looking at some of the products that they have, they're so innovative. We've got suppositories. We have things that melt in your mouth. And these are balanced products that could support a medical patient just as well as a vaporized product with dry herb. And I think this is something for my mom, it has taken the edge off. With Alzheimer's and early stages, they are so aware that there is something going on. They're so aware they're not doing what they're supposed to do. She's in a different country waiting for her visa. It's stressful. She doesn't have a passport right now as we wait. There's all kinds of things. She's not in her home, and she progressed upon visiting here. So that's why we're in this position. And I think, I can't put her on a plane and send her back to the place where she was tripping, falling, and almost burning her house down. So we need to take care of our parents and we need to advocate for them. And that's exactly what I'm doing with my knowledge. But again, just like the female health, we need to educate those that are 50 like me that might have aging parents or younger or older. And we need to make sure that we have something for the elderly communities as a resource. And this could be, this is for some reason, we look back at how we got to this place was from the children, the mamas advocating for the female plant as females for their babies. That's why we're here today talking on this podcast. Those mamas are going to age. Those children are going to age. We've got a whole scale of ages that we need to focus on. And I think if we can do this again as a collective, getting people from the outskirts to come on in, know that it's not a scary situation, and know that this could maybe make their life easier. And this is why we're doing it. And everything skirts on the outside of the gray market when it's coming to products over the counter. But for the medicinal market, it's very viable, and it's viable here. So I do think this is something that we're going to be. I just can't put my mom on a vape. It's not gonna work. So I have to do what I've gotta do because 'cause I'm not gonna let her fade into the blackness without some type of support from me to keep her present, and I think that's super important. But she sleeps through the night, she waits for her oil, she's completely happy with it, she lifts her tongue up, she knows that's what we do at night, and she knows what we do after breakfast, and, on top of that, of course, we've got lots of different kind of health supplements that we support her with.
That is fantastic. I mean, you said so many things that I want to pick at, but due to time, I can't. But I just like wanted to just, I mean, first of all, thank you so much for all of the amazing work that you have done advocating for medical cannabis for women's health. Um, just to make sure that medical cannabis is recognized as a medicine and not just a last resort sort of medication. And also, one of the things that I suppose touched me, because I'm somebody who probably has had the same experience, and I'm thinking everybody with a chronic illness has had this experience, unfortunately, is that having to advocate for your care with the GP. I mean, it's just appalling. I can't even. Yeah, 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 exactly. So when your quality of life is already struggling, and like you said, you were juggling so many different things whilst managing chronic pain, and then going to the doctors who are supposed to be well, your primary carer. They're your primary carer. Like, that is what they are registered to do in the UK. And you go to your GP and they're just, I tend to find make the situation so much more worse and put you in such mental distress on top of all the stress you're already going through. And that's really something that needs to be addressed and challenged in the UK healthcare system, full stop. And I also definitely agree that patients should have a variety of choices. I think flour is the main thing that's currently being pushed in the market, and I understand flour gives instant relief. I use flour as well because, again, instant relief. So if I'm in a lot of pain, I'm not waiting an hour for the oil to kick in. I mean, so I completely understand. However, flour is not for everybody. And I'll be honest, sometimes I don't even bother because I'll just lay there or I'll just get the oil because I just the grinding and if you're in pain, my
It's effort. And if you have arthritis, if there's something in your hands, I mean, can't expect an 80-year-old with arthritis to do that either. And I think that's delivery systems. We need suppositories. They make sense, mucous membrane absorption.
Yeah, I think people forget suppositories are the quickest way to absorb everything into the bloodstream, isn't it?
It is, and you know what? There's so much advancement in the States right now that I've watched, and actually in Lithuania, there's a few groups too making them, and it's for female health because, whether they're vaginal or anally inserted, they do have an efficacious, ability that it goes beyond all the bioavailability you can take orally. So, this is getting into your mucous membrane, this is crossing the blood-brain barrier, it's happening. And why are we not doing to me, this makes sense. Dissolvables. Anything that can dissolve. To me, that I see them in the States once again at dispensaries, they're medicinal. Why are we hesitant? They're dosed. There's a clear dosage. To me, that makes sense.
Yeah, so when I was in Canada, I think it was 2019 or so, when I went back to visit family, and I was in agonizing pain. And mind you, I did not realize, yeah, I don't know what is going on here. Mind you, I did not realize that medical cannabis was legal there. So I went and I think I must have spent about 3 days in agony. And my family were just like, well, you've taken so many pills, nothing is working. Like, what's going And I'm like, oh, usually I have a cannabis prescription and that's the only thing that really works for me. And they're like, oh, well, you can go to the shop. I was like, what? So, of course, I went to the shop and the guy just gives me this and he goes, it's a dissolvable, you put it on your tongue, let it sit there for about a minute or something. Sometimes it takes like 90 seconds or so, and then that's it, yeah. And I was shocked that within 20 minutes I felt relief. And I was like, what is this? And why don't I have this in the UK?
Well, I think it's also the nanomolecular structure, anything that's nano, created with nano, what's the word? I'm trying to think. Nano production. There's a word for it. I'm losing it there. But anything that is where the molecules are so dissolvable, it's not allowed here. We don't allow nano products. So I think, there's different encapsulations you could do with micro encapsulations. There's different enteric capsules that you can take, but they do not want anything that is, where there's nanotechnology applied to the process of production. And I think that's what the word I was looking for. And I think that's where we struggle here because it limits us. It limits us, but why not? I mean, we're talking about a plant. Maybe it's the synthesis. I'm not sure. I'm not a lab technician, but to me, in the States, it seems to be doing very well. People are making progress with their health because of these highly bioavailable products like you experienced on your tongue. If the structure of the molecules are very, very, very minuscule, they'll be able to be absorbed faster.
Okay, so I'm very confused because I worked in substance misuse services, and I do remember us changing a lot of patients to from, was it buprenorphine, I believe. They were either buprenorphine or Subutex, and changing them over to Espranor, which is the dissolvable version. So why was that allowed within?
Maybe it was a different, maybe it could be different. I know in the cannabis space, nanotechnology is often used to make the cannabinoids more bioavailable. And I think that there is some hesitation on using that here. I would have to look into it, but I don't understand why. Like I can't. It doesn't make sense to me. But I know even when we're talking about topicals, for instance. I've got a topical from the States, um, and it has THC and CBD in it from my mother's hands. It's brilliant. It's small amounts needed, but it is a nanotechnology based product. So when she puts it on, she feels relief almost instantly. Almost instantly. It's like nothing. She couldn't lift her arm because of bursitis. And when I put it on, she was like, "Oh wow, look at me, look at me." And I was like, I mean, this was like seconds. This is a woman that doesn't know what I'm looking for. So she's just like, "Yeah, no, it's working." What an honest example. And I think that's something, it transfers from humans to pets. It makes sense to have things work quickly because then we also have patients that have satisfactory experiences who will then believe the product works best. I think it's our job as an industry to know our supply chain all the way down to the very beginning. The traceability complete 100% needs to be understood. But then why are we not giving people exactly what they need? And why are we not giving people product that actually works? Because everybody's so different. You're different than me, and we could have the same product and have a different experience. But that goes on to the precision medicine. That's my whole other soapbox that I stand on, that I really believe that with DNA analysis, we will be able to know what I need. I know I've done my DNA for endocannabinoid system deficiencies. I know what I need, and that's exactly what I got. I gave it to my doctor. I gave it to my prescriber, and he gave me what I needed. Boom, done. No guesswork. Know what I have. It works. Daytime, nighttime. And, why are we not doing that?
Really don't know. I was about to call discrimination on the whole case because I'm like, well, you accept the certain substance misuse services. Why is it not allowed? I'm going to look into this because I'm actually just out of curiosity for myself, anyways. Because that's a very weird one. Yeah, I know exactly. That's what the whole podcast is about. Education. Exactly.
Exactly. Sharing and educating. And it's not it's like I try to keep my opinions to myself, but I also know what I've seen. And when you see results in the real world, why can't we elaborate on it? Why can't we look into this? What is everyone so frightened of on the authoritative level? Like, why are I mean, what are we risking helping people get less sick? If the NHS is overwhelmed, why are we not treating money? Follow the money always. I know, but it's just so sad because I went to the GP the other day. I thought, I need to get some blood work done. I've got cancer all throughout my family. I've had cancer. My mom's got Alzheimer's. Let me see where I'm at. What kind of genes do I have going on? They were like, absolutely not. We do not spend money on that. There's no way. And I'm American. I don't know. I just walked in. I was like, hey, I've got a mom with Alzheimer's. I don't want to go that way. Can we just check? Do I have the BRCA gene for cancer? Could we look into? No, no, no. Unless you're sick. I said, so you're okay with people getting sick and then being overwhelmed with sick people? Where, where's the prevention? Well, if as an American living here, I mean, I'm knock on wood, very healthy since the hysterectomy, but I'm like, what's going on, man? Like, why are we not doing this? It doesn't make sense.
Heidi, do not even get me started on that topic. Just don't even get me. The criteria in the UK is absolutely ridiculous when it comes to healthcare. It's something that I actually have complained about on this podcast as well. Is that I tend to find that in the UK, in order to meet a criteria for a diagnosis, you actually have to be much sicker than in other parts of Europe in order to meet the criteria for the same diagnosis. So it's clearly like
And then the care they need to spend more money on you for care.
no, and this is the part that I get frustrated about because if you had taken care of the person at the early intervention, because I believe in early interventions, and if you take care of the beginning stages, yeah, then what will happen after that is that you're going to have somebody who's going to recover quicker, who's going to be able to go back to work, contribute to society, not struggle with much anxiety and depression. Because right now, what we're having is people who've now had to leave work because they cannot work and they're not sick enough for a diagnosis. Then they're not even getting benefit supports because you can't get disability benefit if you don't have a diagnosis. So there's that issue. So they're only getting a minimal sort of support. And then there's the issue of their mental health declining. So now they have to go on more medication to support with their mental health or get referred to mental health services and stuff like that. All of this can actually be avoided had the patient, no, sorry, had the healthcare system if allow for early intervention. Let's just put it like that, because I will start ranting, and that's just a whole other topic.
Between you and I, we could have like a 6.5 hour podcast. We would beat Joe Rogan. No, it's so true. I mean, it is very frustrating, but going back to why I do what I do, and support the CBD companies that have quality products is because we need to make sure as we're educating, we have a direction to point the people into. We have a direction to point them to good products, good CBD products. I think we have shaken out the yucky ones over the years, for lack of better terms. I think the people that like get in on this green rush, and I'm just gonna leave my corporate job. Now, nobody got a playbook on how to run a cannabis company. Nobody. We have winged it and we have failed and we have seen who's rising from the failures because you got to fall in order to succeed. And the greed in this industry absolutely shook down companies. I was unfortunately involved in a couple of them where I was a worker. I wasn't an owner and I watched what happened. It's a shame. But at the end of the day, who are we cheating? We're cheating those patients out there that we're supposed to be supporting. And that's why those who are here for the patients, here who are championing women, here who are championing those who can't speak for themselves, we need to speak for them as internal industry professionals, and that's why I do what I do, and only associate with the good ones. Um, and I think, and we're almost there. And I think with the London events that are coming up this season, we can really have a cool educational area in each one of them and bring people in, get those canna naive in, bring them in. Let's show them what's up and give people an opportunity from the elderly, all ages. Well, legally, whatever, 18 and up. Yeah.
No, no, I fully agree with you. Just as you mentioned, speaking for those who can't speak for themselves, I feel like that's going to bring me into the whole pet stuff. I want to know all about it.
Absolutely. I was thinking the same thing. Now I can really stand up. Well, my background was in veterinary medicine. I also ran an animal care company, which I sold before moving to the UK. I've done emergency animal rescue work. My whole life has been around animals, literally since I was 8 years old. And I rescued my first dog and would not go into the school because no one was there with the dog, and I just sat outside the school and was truant because of that. My life is speaking for those who can't speak for themselves. It's always been that way. And as a medical professional in the veterinary space, I was taught strictly pharma for years until my own dog got something called the histiocytoma, which was on her nose, and it was benign but cumbersome. So we debulked, and ended up going into her palate, becoming cancerous. So when it metastasized, I went to a holistic vet that was recommended to me. Didn't even know what I was walking into. This was 2000, maybe two. And I was in Florida, and this doctor looked to me like the best witch I'd ever met in my life. I was like, she had plants and things and potions, and I was like, where am I? Like, this is kind of where my heart sat, but didn't know it existed. And Dr. Keller introduced me to this world of plant medicine. Now, we even skirted on the cannabis side, but I'm not supposed to say that because it's not supposed to be, but it's been many years. So hopefully we're grandfathered in on it. But my dog lived for an extra 8 years after a 6 month death sentence because of Dr. Keller's work. Sold. Tell me what to do. I was like, this is exactly, because she's like, we're activating systems that are dormant. We're doing this. I mean, this sounds very cannabis like, and I don't even know. She gave me little tablets and pills and granules, whatever it was she gave me, I did. And it opened up my eyes to it. So when I thought, I have rescue animals, I always have. I take the misfits, I take the ones with medical issues. Why am I pumping them with prednisone or carprofen or Medicam or all the things that are typically given for pain and for antispasmodic, gabapentin, everything for animals? If they could take what we're taking, I dove into understanding the endocannabinoid system and the pharmacokinetics of cannabis in it. Um, I aligned with a lot of different veterinarians before I decided to make a CBD company for people and pets, horse and rider. And I wasn't able to sell it in the UK because right when I launched, the UK said no CBD for pets. It's not happening. But veterinarians prescribe it, but they have no knowledge. But it has to say for humans. I mean, it was bonkers, and it's still to this day in this state. But I'm doing something about that. So, for my own personal pets, I had a seizure dog, no longer seizing. I have a 21, almost 22-year-old terrier, still going strong, slightly incontinent, but eats every day and loves his life. And I've got a huge dog that should have hip dysplasia by now, but doesn't, because at 65 kilos, he is running every single morning and he's on cannabis every single day. I also have a 31-year-old horse. I keep things alive. And I thought about, I'm using my own products on this, but in the States, I sold my products to everybody over there with this. And all my Naked Leaf products went out prior to selling my company. I was kind of the heartbeat of that. So without me there, I think it kind of waned. Nevertheless, I made an impact. I had stirred up some of the more conservative companies to look into this themselves, and more power to them. They started giving CBD pellets to horses over there. I helped animals on chronic medication come off in different sanctuaries. So there's a whole bunch of reasons why animals could use CBD. Newly adopted animals, let's get them to adjust better. Those are in the shelter, let's get them more adoptable. Let's take them down a notch from this horrible anxiety of not knowing where their life is going. Post surgery, when animals are in kennels to heal, cage rest, they call it, or crate rest. Horses that are on box rest for various laminitis issues, or maybe a tendon issue or anything like that, where they have to stay in their stall. Imagine being in a box all day, or imagine being in a crate all day and not knowing why. I can't be a dog, I can't be a horse. Let's take it on and create less inflammation. So there's like so many multiple purposes, as we know about cannabis, but the combination really suits animals. And guess who are the most honest reporters of how things are working? It's animals. They're either lame or they're not lame. They're nervous or they're not nervous. They're chewing up your sofa or they're not. the anxiety's gone. You know what I mean? Like you can save your sofa, save yourself, and keep animals in the homes that they deserve to be in because they are a commitment as much as getting married and having a baby. You don't bring an animal in to return it. You have to take care of them for life, and you should be armed with all the necessary alternatives. And that's why I'm working with the Pet Pharmaceuticals group. We have a beautiful array of veterinarians on this board, and the research that's going to be being done here is going to be for prescribing purposes in the UK. So we're going to hopefully turn this 2018 no CBD for pets on its head and provide a channel for opportunities not only to educate the veterinarians with groups like the Veterinary Cannabis Society and other groups that educate veterinarians around the world. We're just a little behind over here. We're going to give them a product. And I think that product is going to be a wonderful opportunity for people to now have alternatives here in the UK because this is my home now and I want to make sure we serve our pets.
That is just remarkable, honestly. I didn't even realize that there were so many benefits that actually are cross species in terms of the benefits that we get and the benefits that they get kind of mirror each other in a way. And I know biology, whatever, we're the same, yeah. But either way, I did not realize the huge impact that it had. Like about 8 years. Like the whole time you're talking, I was thinking about our dog that we had to put down. She was 16 years old, or was she 17, and she had a broken hip. They had done surgery, and she was just in so much agony. Was taking loads of opiates, and was again in just so much agony. Could not even eat. She could barely even see where the bowl was. She had no just cognitive functioning at all. And they were like, sorry, you have to put her down. And that was the only thing that was wrong with her hip. Like, and it was the most heartbreaking experience I ever had in mind. I don't think I've ever cried that hard for a human.
No, well, you know what I always say, animals have no other agenda but you. They don't read email. They don't get the bills. They don't care about anything. They just want to be like, we love you. So, what are we going to do for them? We need to be armed with info. We need a toolbox in our home for our people and our pets. And that toolbox has to have cannabis in it, in my opinion. It has to have some form of hemp CBD. It has to have some form of medical cannabis because someone's going to need it, whether it's your children to your pets, everything in between. Someone's going to need this, but we need to educate, which is what you're doing here today. And that's why I'm so happy to be here. And I'm really excited to do more work with Sanskara and other different types of patient groups here. You know, I know so many, I'm so ingrained in the community in this country, and it's getting better. We're getting more collaborative. Everyone's crossing over. There's no one lane for each person. We need to be rolling together. And I think we are. And I think now that we're going to make a difference.
What would your advice be to the future of the industry? Actually, I was gonna say, yeah, industry. What would your advice be to the industry? The whole industry? Yeah, I'm actually gonna go in. Let's go in. Let's go in.
Well, we have to break down the borders. There needs to be a communicative language, um, council style regulatory basis for all aspects of cannabis. We need to speak from the border control to the cultivators to the labs to do their job properly. So we know what the cultivators are actually giving us to the production of the medicines to the border who understands all those parts so they don't stop things from coming over. And hopefully we can have a global patient scheme that allows people with cannabis needs to be able to travel, that allows people to be able to treat themselves. It's a taxable product that can support and countries with deficits. We've done that in the states. You know, each state's deficits go down with the taxation of cannabis. It has to happen if it's a commodity. It can't be free, but we could also help support marginalized communities with some of those taxes. So I think this is an opportunity to really come together. Maybe cannabis will save the world. I don't know. I always wish for peace on earth. It's a silly thing to say nowadays, but I really still believe that it's a possibility with the right leadership. And the most important part of this industry's growth is we need to empower the people to advocate for themselves, to get sophisticated education, to ask questions. And once those questions cannot be answered, those people with their MDs and all their GPs and all their other wonderful accolades they've achieved educationally, they're going to start questioning, why can't I answer these questions? Why are these people smarter than me? They need to get some continuing ed so we can start helping that. We cannot neglect the fact that we've got a crop of new doctors coming out every single year. Why are we not educating them now? Why is it only in toxicology? Why are we not letting veterinarians understand the pharmacokinetics and that there has never been a lethal dose on an animal ever? There's no LD50 in animals. Why are we not explaining that so we could take the fear factor away? So it's education. It's a global communal language that needs to come together so that it can be made. I know every area is going to have the regulations culturally, etc., but we shouldn't stop patients from having their medicine. We shouldn't stop people from having choices, and that would be for their pets and their elderly and their kids and all of that good stuff. So it's iffy. It's a wish, but I think everything starts with a dream, and if you don't dream big, what's the purpose? So I think we're all still standing here. We've been knocked down. So I'm sure there's many more of us. And I know in my women's group, we've got 510 women that have been through the ringer and they're still standing and screaming loud. So if we all scream loud from the rooftops, we'll be heard.
Yeah. And what advice would you give to, I suppose, cannabis naive patients that are considering it for either medication for themselves or even their pets? Oh wait, pets is not legal. Sorry, medication. Yeah.
It's not legal here yet, but I'm working on it. I'm working on it. I'm working on it. Um, really working on it. It's 5 years of working on it. 6 years. I think that the cannabis naive need a place to go. And I think we need to make it very public. Like, are you curious about cannabis? You can scan this QR code, and there can be just a little bit of a Bible. Hey, this is what you can do in the UK. Here you go. Boom, 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 boom. And I think having outlets and having places to go. It's word of mouth definitely gets. I mean, at my gym, everyone's like, "Oh, the girl with the CBD, the American, the cannabis girl." You know what I mean? I get labeled. And people want to ask questions, which is how we came to our women's thing. I think that needs to happen more often, and I'm very outspoken. I talk about everything, and I think it's really important because I don't want people to shy away from it or go, "Ooh, it's okay. It's legal. It's okay." It's better than to buy it from the guy in the corner. You know what I mean? It's better to go this route and know what you're putting in your body. And I think there's so much hesitation with the NHS, unfortunately, because I've known people that have been in cancer chemo situations and they've asked for it and they're like, no, 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 you can't do that. Well, no, you could. You could on your own accord because you have free will. So I think the cannabis naive need to be supported with more opportunities for outward education. Maybe, it needs to be continuous too. It needs to just be like every Sunday there's an opportunity or, something with an all rotating group of professionals collectively working together to get people in.
Fantastic, Heidi. No, I fully agree. I think we need a lot more collaboration. I think it's something that I'm currently seeing as well as more people are collaborating with one another. I sort of feel that the industry often sort of like clinics isolate themselves and there is no unity when really there should be a unity between the different clinics because every different clinic has a different specialisms and different doctors and different things that they can offer. And I know personally when I was working at one of the clinics and I came across a patient that we could not treat, I would refer them to another clinic where I have identified somebody that could treat them, so they're still getting treatment. I don't do all that competition nonsense. I'm here for the patient. The patient needs help, and if my clinic can't help them, I'm going to identify the clinic that can. Um, yeah, I think collaboration is needed. There's too much money hungry people here, and that needs to stop. Like, we are patients. And that's me giving my 2 cents. I'm pretty sure I got myself in trouble with that sentence. Come fight me. So
I get myself in trouble all the time, but I feel like I'm just saying what's in my heart. And, I'm in this industry because I love people and I love animals and I want to see everyone have a choice. It's not fair to not have choices. We're not looking to kill anybody. Nope. We have opportunities to discuss drug interactions with everybody. But it has to come from the pillars of the community, and I consider us pillars. We're pillars of the cannabis community and a nascent, we're only 10 years young. So we've got time to shape it up. This is okay. We need equality, we need diversity, we need education. We need to be inclusive, we need to bring everybody together. If we're not that, we're failing. We can define all those cultural and historical norms all day long. They're boring and passe. Forget it. The women right now, we're only about 20% of us running this cannabis industry globally, but I think we're leading, in my opinion, because we are doing something about it. We're sitting here today.
Yeah, no, no, it's true. It's true. We're actually being very proactive. I'm very happy with a lot of the work that we're doing, and I cannot wait to see more of the conferences that you're going to be holding. But you know what? I'm going to leave it at that because I like to leave people with something to think about. Um, yeah. So, everyone, thank you so much for joining us here today. Heidi, thank you so much for joining us. If you're interested in some more of the work that Heidi does, the links will be in the description. And we look forward to seeing you next week where we will be discussing medical cannabis and psychiatry.
Oh, wonderful. Thank you so much, Berta, for having me.
No worries. Bye.
Bye, sweetie.